Is this you? You've had years of therapy with few results. The length of time may vary, but it's important to understand that a prolonged period of therapy, in terms of years, with little to show for it, is something to pay attention to. This is especially true if you've worked with several therapists for long periods of time and have little to show for your efforts. Some people use therapy as a source of support rather than as a place to make progress on mental health concerns. And this is a valid approach to therapy and can be one reason a person may be in therapy for years without much evidence of progress or change. Aside from this, though, the only other reasons I can think of are indications of problems. Years of therapy without results might be an indication of poor therapeutic rapport. That is, a person might feel that their therapist isn't a great fit for them. Or worse, they might believe that the therapist isn't very invested in trying to help. The person might find that therapist to be judgmental or cold instead of compassionate and supportive. These all feed into the second potential problem, a lack of safety. If someone experiences their therapist as judgmental or cold or dismissive, they are very likely to be lacking a sense of safety in the relationship. Without some sense that you can be vulnerable without being hurt, it's hard to take the small risks and experiments that can lead to big personal growth and healing in therapy. A third issue that can underlie years of therapy with few results is therapy that didn't treat the root cause. I see this a lot in my work with dissociative identity disorder. For instance, if a therapist is unaware that their client has DID, they may focus on the client's anxiety, PTSD, or depression. And these are issues that, of course, have huge impacts on a person's life, and they definitely deserve to be addressed. But treating anxiety or PTSD won't address the weird experiences that people with DID have, such as finding themselves across town or the state without knowing how they got there. If you've been in therapy for years and years, and it seems like you should have made more progress than you have, it's worth considering that perhaps you have a dissociative disorder, which has gone unnoticed and untreated so far. Or think about conditions that involve structural dissociation, which would be a borderline personality disorder as well. This is especially true if over the years of therapy, you've worked with multiple therapists and have little to show for it. If you're in therapy with a therapist you have a good rapport with, you might want to bring this up with them. You can ask if they can assess you for a dissociative disorder or refer you to someone who is skilled in this. If you're currently in therapy, but don't believe your therapist is someone you can discuss this with, my first response would be to get another therapist, period. This is an indication that you don't have a sense of safety or a good therapeutic relationship. You deserve to have that, and I encourage you to look for that with another therapist. If you aren't ready to move to a different therapist, I would encourage you to at least find a therapist who is knowledgeable about dissociative disorders and meet with them for an assessment.